It has been a great experience practicing with my two sons. My oldest son, Zach, has been in practice with me for 9 years, and my youngest son, Alex, he's in his second year of practice with us. It is a great family practice. On our logo, it says Generations of Smiles. And the Generations of Smiles is unique because we have the next generation of orthodontists, my son's in with me, and we also are treating second and third generations of patients, which is a lot of fun because sometimes we see parents that come in and we are treating their children. Or sometimes we have treated parents and we treated their children and now we're treating their grandchildren. So the generation idea is really unique because it spans the practice with the doctors, and it also spans the practice with patients. There are several groups of patients in our practice. Close to 40% of our practices are adults. And adults are unique because they have a different view of what they want and expect, and we are able to offer that because we are so personable in how we practice. We treat each patient as a different person. We don't look at them as a group, and they expect certain things, and I think they appreciate things in a different way because they've lived with their problems for so long. I also find with adults, what is unusual is that we'll often treat the children first, and then the adults are seeing the changes in their children, and they realize that those changes can happen with them. And you really end up with long-term relationships and friends in doing that. The teenagers are unique because a lot of them come in and they never smile. And you realize as you're going through an exam and seeing them that they are covering up their face or covering up their teeth, and we'll just ask, why? Well, they don't like their teeth, they don't like their smile, or they've been teased. So you can help them in many ways with their self-worth as they go through their life. And you really know when you've done a good job at the end of treatment, when you get this great big hug from a patient and you realize how important and how much you've affected their lives. And we treat a lot of special needs patients. And I have a philosophy that special needs patients can do a lot more than you think if you take the time and explain things to them. I also have an idea that when a special needs patient comes in, you do not start treatment right away. I may bring that patient in for 6 to 12 months, maybe once a month, have them sit in our clinic while we are working on other patients so they can see how things go. And as long as the parents are willing to take the time, we see those patients very easily mold into the rest of the practice, and they not only surprise us, they'll often surprise their parents on what they allow us to do and the confidence that we gain in them. We basically follow them through their lives. So we're seeing sometimes those patients over a 20-year period in and out doing different things. And we see some major changes with those patients. So the practice of orthodontics is very rewarding because we see so many things change in people's lives, in their smiles, and we really have some special bonds with those patients.